Hello, my name is Dr. Matthew C. Bernhard. I am a board-certified orthopedic surgeon. I currently practice in both Ashland and Richland County. It has been my honor and privilege to practice in Ashland and Richland County for the last 14 years. I'm a board-certified orthopedic surgeon and board-recertified orthopedic surgeon that practices general orthopedics, however, primarily specializes for the last 12 years in total joint replacement, which is my specialty interest and my focus. I've seen a lot of innovations in my 19 years as a doctor and my 14 years in the Ashland-Mansfield area, and it's been a privilege to work forward with patients and new innovations in both joint replacements, bearing surfaces, and minimally invasive techniques for joint replacement surgery. Although the minimally invasive joint replacement surgery that I do is very rewarding, one of the newest innovations that I've had is in pain management. And something new has come onto the forefront in multimodal pain management. Today you're going to see or have the opportunity on my website to see just a few patients that are my first patients that we've used this new exciting technique. The medication that I currently use is a medicine called Exparel. What we're trying to promote is not only a minimally invasive joint replacement procedure, which we've been doing now for nearly 6 years, but minimal pain with the joint replacement. This injection technique has been an incredible revolution, and I did not believe that it would give me the results that I'm seeing currently now. The patients that you're going to see on the website are just a few of my first patients that had it. What I'm experiencing is that the narcotic use is almost gone. The time in the hospital is cut down to basically an overnight stay, and my ultimate goal is to proceed forward with outpatient joint replacement surgery, meaning less than 24 hours. In the last 3 weeks since using the Exparel, my length of stay for almost all patients -2 has been an overnight stay, and they've went home the next day. A couple of examples. After giving Exparel to one of the patients that you'll see on the website, this gentleman was 74 3 years ago when I did a knee replacement. He stayed in the hospital for 3 days, went to the nursing home for 2 weeks, and was using a narcotic roughly for 6 weeks. 3 years later, he desired his other knee to be replaced, which I did do using the minimally invasive technique with the Exparel solution. I then discharged him home in 2 days, not a nursing home in 3 days, and he was off his cane and walker in a very short period of time. The gentleman never required any narcotic pain medication and didn't even take his Ultram. He was taking simply an anti-inflammatory along with Tylenol. At home physical therapy, his first visit, he had 110 degrees of bending and came in today at 2.5 weeks with 127 degrees of range of motion, no cane, no walker, and he was basically in shock and disbelief on the difference between his knee replacement from 3 years ago. This is but yet one example of a patient that I've had the pleasure of working on, and to me, the same surgeon with the same implants, with the same technique at the same hospital. The only difference in this gentleman was my multimodal pain medication technique. This is not a cure for every pain that ails a patient after knee replacement, but this has been a wonderful innovation. What we will try to do through the website and through patient education is have links to where you can look up Exparel and the multimodal pain treatment. We also will have the patient testimonials, and please visit my website for other links to areas that you can go for minimally invasive knee and hip replacement surgery. Something exciting that I'm looking forward to is trying to get to a point where we're doing outpatient joint replacements. Of course, this depends on patient health, patient age, patient home factors, as well as family factors and multiple comorbidities. Although no one medication guarantees an outcome, please talk to your orthopedic surgeon about this new innovative technique. And if in the Ashland-Richland area or surrounding areas, feel free to contact me, Dr. Matthew C. Bernhard at Mid-Ohio Orthopaedics and Sports Medicine. Thank you.